And then of course, the final exercise, my favorite exercise, passive knee extension. So all I'm doing is I'm propping my surgical knee so that my foot is on another chair in front of me, or I can put it up along the side of the bed or the side of the couch. It should sit without any support under the knee, but I also want to try and keep my foot as straight as possible. Many of my patients have a tendency to let that foot turn out because of hip tightness and other issues going on, maybe some spinal stenosis. That foot needs to stay as relatively straight as possible. So sometimes what I do is I recommend getting a chair that has an armrest so that the armrest will support the foot, but I want to be mindful that I don't put too much torque on the knee. So we always want to find a compromise so that we can adapt to our current level. There are some people that are very fit, very flexible. It's easy for them to do this. There are other people that struggle a little bit more. We always want to find something that's right for you at the level you're at. So in this case, I prop my heel, I leave my leg unsupported. I would spend 5 to 10 minutes in this position. If it gets too uncomfortable, I could always bring the chair in. So now I've got support under the calf. I've got my foot resting on the backrest of the chair in front of me. But if I can tolerate it and it doesn't dramatically increase my level of pain, I want to be in this position, nothing supporting the knee so that the knee can sit in full extension. In some cases, I've also had patients that were able to cross their legs, so their non-surgical leg is on top of their surgical leg. They would sit in this position to watch TV, check their email, do things that takes their mind away from the discomfort, but allows them to spend time in this low intensity, long duration mobilization.